The soldier hit the floor of the trauma bay before the gurney stopped moving. His chest wasn't rising right. Blood soaked through 3 layers of field dressing, and his eyes, glassy, half gone, swept the room once and locked onto the woman standing furthest from the action. Not the attending, not the charge nurse barking orders. The quiet one near the supply cart. His cracked lips moved. The monitor flatlined a second later. And in the half-second before chaos swallowed the room whole, everyone heard what he said. Not a prayer. Not a name. 3 words that made no sense to anyone in that trauma bay. Except her. She didn't flinch. She didn't move. She just looked back like she'd been waiting for exactly this moment her entire life. Before we go any further, if you're new here, hit that subscribe button right now, because this channel is where the stories go that most people are too afraid to tell. Stories about the people who get overlooked, pushed down, written off, and then prove every single person wrong in the most devastating way possible. Hit the like button if you're already hooked, and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. Now, let's go back to the beginning. The first thing people noticed about Claire Whitmore was what she didn't do. She didn't complain when the supply cart got reassigned to the newer nurses. She didn't argue when her name got left off the scheduling memo for the 3rd time in a month. She didn't raise her voice when Dr. Owen Garrett talked over her in triage, again, or when head nurse Elaine Voss passed her in the corridor without making eye contact. The way you pass furniture you've stopped registering as anything more than background. She was 38 years old, 5'6", with hands that were slightly too calloused for someone who'd spent the last 2 years working the evening shift at Crestwood Regional Medical Center in Fort Calhoun, Nebraska. She wore her dark hair pulled back tight, no jewelry, no name badge lanyard with little charms on it like some of the others. Just the badge clipped flat to her scrub pocket. She moved through the department like someone who'd learned to take up exactly as much space as the job required, and not 1 inch more. Nobody knew what to make of that, so they mostly didn't bother. Crestwood Regional wasn't a teaching hospital, and it wasn't a trauma center, not officially, but it sat close enough to the interstate and to the base at Fort Calhoun that it saw its share of serious cases, farm accidents, highway crashes. The occasional thing from the base that got routed their way when the military clinic was backed up. The ER had 22 beds, a trauma bay that had been renovated 3 years ago and still smelled faintly of new drywall under the antiseptic, and a staff culture that had calcified over time into something with very clear hierarchies. Elaine Voss ran those hierarchies. She'd been head of nursing services for 11 years, which at Crestwood was something close to a geological fact. Elaine was 53, efficient in the way that very organized people with very fixed opinions tend to be efficient. She knew every shift rotation by memory, could recite supply inventory off the top of her head, and had an instinct for identifying who on her floor was going to cause her problems. Claire had been flagged as potential trouble her first week. Then Elaine had actually watched her work for a month and revised that assessment. Claire wasn't trouble. Claire was something stranger. A nurse who did everything competently and quietly and without apparent ambition, who never pushed back, never sought attention, never tried to climb. That should have been reassuring. Somehow it wasn't. "Whitmore," Elaine said one Tuesday evening in mid-October, not looking up from the medication audit she was running at the nurse's station. "The bed 4 patient needs repositioning." "I saw it in the notes," Claire said. "I was about to head in." "I'm not asking if you were about to. I'm telling you now." Claire went. She didn't say anything. That was the other thing. She absorbed correction the way a sandbag absorbs water, completely, without protest, and without any visible change in how she operated afterward. It should have made her invisible. Instead, it made Elaine inexplicably angrier. Dr. Owen Garrett was simpler. He was 34, 3 years out of residency, and he had the particular confidence of someone who'd been told he was exceptional so many times that it had stopped being motivation and started being just a fact he lived inside. He was not a bad doctor. He was in fact reasonably good, quick with differential diagnoses, decent procedural skills, the kind of instinctive pattern recognition that gets residents through brutal call shifts. What he lacked was the ability to be uncertain without someone else paying for it. "Whitmore." He stopped at the supply cart where she was drawing up medication. "You charted the wrong dosage on the Hendricks patient." Claire looked up. "I charted what was ordered. The order got revised. You should have caught the update." The update came through 18 minutes ago. I've been in with Mr. Hendricks since before that. Then you should have checked before you drew up. She held his gaze for 2 seconds, which was 1 second longer than she usually did. Then she set down the syringe carefully and said, I'll verify with pharmacy before administering. He walked away. She stood there for a moment with her back to the corridor, and she let out a breath through her nose, slow and controlled. And then she picked up the syringe and went to the phone. That was the pattern. Garrett pushed, Elaine issued corrections that weren't corrections. The newer nurses watched and learned to treat Claire the same way. Not with outright cruelty, most of them, but with the easy dismissal that follows when you take your cues from whoever's in charge. There were exceptions. Marcus Webb, one of the overnight techs, would bring her coffee sometimes and sit with her on slow nights. Priya Sundaram, a second-year nurse who'd come up through a different program, asked Claire for advice once about a difficult IV placement and then seemed surprised when the advice actually worked. Small things. Not enough to change the temperature of the room. Claire didn't appear to need it to. She clocked in, she worked, she clocked out. She lived in a one-bedroom apartment 12 minutes from the hospital. She ran in the mornings on a route that took her past the river. She slept without apparent difficulty and spoke to no one about her past in any detail. The closest anyone had come to a real conversation about it was Marcus, 2 months ago, sitting on the ambulance dock on a slow Thursday at 2 in the morning with terrible coffee and the kind of silence that gets comfortable fast. "Where'd you work before here?" he'd asked. "Different places," she'd said. "Like travel nursing." "Like different places." He'd nodded like that answered something. Maybe it did. The night it changed started the same as every other shift. Claire came on at 7, did her handoff with the departing nurse, checked the board, and started working the floor. There were 14 patients. 3 were waiting on lab results. 2 were post-procedure and stable. One was a 40-year-old man named Ronald Greer, who had come in complaining of chest tightness and was about 80% certainly having an anxiety episode and 20% possibly not, so she kept her eye on him. Garrett was attending. Elaine had the floor from the nursing side. Standard configuration. At 9:14, the radio at the ambulance bay crackled. The paramedic's voice was flat with the specific flatness of someone working hard not to sound rattled. "Crestwood, we are inbound with a 29-year-old male, penetrating trauma to the thorax and right axilla, estimated blood loss significant, BP 60/40 and dropping, GCS 12 but declining, ETA 4 minutes. Claire was already moving before the overhead announcement finished. She wasn't on trauma that night. Elaine had quietly rearranged the assignments 2 weeks back, so Claire was consistently on the medical side of the floor rather than trauma bay coverage. But she went to the supply room first, not because she was planning anything, just because something moved in her chest the way it sometimes did. A low-frequency recognition that the paramedic's calm wasn't calm, it was suppression. She pulled a chest tube tray from the third shelf, set it on the cart just inside the supply room door, not staged anywhere visible, just available. Elaine appeared in the doorway 3 minutes later while Claire was checking the thoracic supplies. "Whitmore, trauma bay is covered. I need you on the medical side." "I'm aware," Claire said. "I had a question about the thoracic inventory." "Handle it later." Elaine's eyes moved to the chest tube tray, then back to Claire. Something passed across her face. "Step away from that cart." Claire stepped away. She went back to the medical floor. She checked on Ronald Greer, whose anxiety was in fact anxiety, and who was already looking better, and she stood at the nurse's station and listened to the sounds from the trauma bay down the hall. She could hear them clearly. The doors weren't fully closed. The paramedics brought him in at 9:19. From the station, she could see the foot of the gurney, the flash of blue nitrile gloves, the particular urgency in movement that means the people pushing the cart know the margin is thin. Garrett's voice carried, quick, professional, calling out orders for fluid resuscitation, type and cross, imaging. Elaine's voice, tight and efficient, a younger nurse whose name Claire didn't catch. Then a pause. It was the kind of pause that has a texture to it. 30 seconds, maybe 40, where the voices changed register slightly. Still controlled, but with an undertone that wasn't there before. "Get me an ultrasound." "Already here." Another pause. "Okay." Garrett's voice, slower now. "Okay, I need a... Let me see the tray." Claire came off the wall. She didn't run. She walked with purpose, the way she'd learned to walk through spaces where speed attracted attention and attention attracted interference. She was at the trauma bay door in 15 seconds. Through the narrow window, she could see Garrett at the head of the bed with the ultrasound probe, and she could see the patient, young, pale, the kind of pale that isn't pallor, but exsanguination, the skin taking on that particular translucency. And she could see on the monitor that his pressure was 58/30 and the waveform was wrong. Tension pneumothorax, her brain said. Not a question. She pushed the door open. Whitmore, Elaine's voice, immediate. This is not your bay. His trachea's deviated, Claire said. She wasn't looking at Elaine, she was looking at the patient. Left side, you've got a tension pneumo. Garrett looked up. I see the effusion on fast. I'm trying to determine. There's no time to determine. His pressure's going to bottom out in the next 2 minutes. She was already beside the cart, her hands finding the needle decompression kit by touch, not looking. You need to decompress now and then place a chest tube. Whitmore. Elaine stepped in front of her. You will remove yourself from this trauma bay immediately, or I will call security. The patient made a sound. Not a word. Not quite. A sound from the throat, constricted and low, that cut through the room like something had been snagged on a wire. Everyone went still for a half second, and then he turned his head. His eyes found Claire's across Elaine's shoulder. They were gray, those eyes, gray and glassy with pain and blood loss. And they had the focused quality of someone who is using every remaining unit of cognition to communicate one thing. He knew her. That was the part that didn't make sense. Claire had never seen this man before in her life. She was certain of it, and yet his gaze landed on her with a specificity that had nothing to do with random desperation. It was the gaze of recognition, of relief, of someone who has just found what they were looking for in a place they didn't expect. His lips moved. Major, he said. The word was barely audible under the alarm tones and the ventilator cycling and the click of Garrett fumbling with equipment. But it was clear. One word. Elaine didn't hear it. Garrett didn't hear it. The younger nurse was focused on the IV line. Claire heard it. Her face didn't change. She looked at the monitor. 44/26. The waveform had gone nearly flat. Dr. Garrett, she said. Her voice was completely level. I need you to step aside. He looked at her. He was going to say no. She could see the reflex forming. And then something about her stillness made him hesitate. It wasn't the words. It was the quality of her attention, the complete absence of panic in a room that was beginning to fill with it. You can't, he started. Step aside, she said, or he dies in front of you. Your choice. The monitor alarm changed pitch. Garrett stepped back. Claire moved to the patient's right side and worked. She didn't announce what she was doing, and she didn't ask permission, and she didn't look up to gauge anyone's reaction. Her hands knew the geometry of the procedure from repetitions done in conditions that made this trauma bay look like a controlled environment, in vehicles, in buildings with no roofs, in the dark, under sounds that didn't belong in a hospital. She placed the needle with the flat efficiency of someone for whom this particular motion has become as natural as handwriting. The hiss of released air was audible. On the monitor, the waveform shifted, not immediately to normal. That wasn't how it worked. But the trend reversed. 51/31. Then 58. The patient's color didn't come back all at once, but his breathing changed, the chest moving differently, and his eyes, still on her, gained a fraction of focus they'd lost. Chest tube, Claire said without looking up. You don't have clearance to, Elaine's voice. Someone hand me the chest tube tray, or I will get it myself. Still not looking up. Marcus Webb, who had come in behind her without anyone noticing and was standing just inside the door, moved to the supply cart and put the tray in her hands. She worked for 4 minutes. By the time she was done, the patient's pressure was 83/50 and climbing, not stable, not safe, but no longer in immediate freefall. His oxygen saturation, which had been at 79% when she'd come into the room, was at 91. She stepped back. Her gloves were bloody. The room was very quiet. Garrett was standing at the foot of the bed with an expression she didn't have a clean word for. Not exactly shame, not exactly anger, somewhere in the compressed space between the two where people go when they've been shown something about themselves they weren't prepared for. Elaine Voss looked at Claire Whitmore with an expression that was much easier to read. Security, Elaine said. Her voice was entirely steady. Call security to Trauma Bay 1. Claire peeled off her gloves. She dropped them in the biohazard container. She looked at the patient one more time. He was watching her still, with those gray focused eyes. And she said nothing to anyone in the room. She walked to the door and stopped just before she reached it. Not because security had arrived, because someone else had. The corridor outside the trauma bay had 4 people in it who had not been there 5 minutes ago. They weren't hospital staff. 2 of them were in military uniforms, Army, combat branch insignia, the rank of captain visible on one and senior NCO stripes on the other. And 2 were in civilian clothes that fit the way clothes fit on people who spend a lot of time in uniform. All 4 of them were looking through the window of the trauma bay door with expressions of controlled urgency. The one with the captain's rank met Claire's eyes as she reached the door. He didn't say anything. He looked at her for 2 seconds with the particular expression of someone who has been moving fast and has just now found the thing they were moving toward. Then he looked past her at the patient on the table, and then he looked back at her, and his expression shifted into something that had relief and weight in it in equal measure. He reached for the door handle. In the trauma bay behind her, Elaine Voss was still talking to someone on the phone, her voice precise and assured, laying out a sequence of events in which Claire Whitmore had endangered a patient, violated protocol, and needed to be removed from the premises pending review of her nursing credentials. The captain pushed the door open. The soldier on the table turned his head again. His pressure was holding at 91/60 now, his color slightly better, and he had enough left in him to do one thing that he apparently decided mattered. He raised his right hand from the mattress, slow, deliberate, and he saluted. Not toward the captain in the doorway, not toward anyone in uniform, toward Claire Whitmore, standing at the threshold of the trauma bay with bloody gloves in the biohazard container and someone on the phone making a case for ending her career. The room stopped. Elaine's voice paused mid-sentence. Garrett turned from the monitor. The captain watched, and the soldier on the table held the salute with the single-minded focus of someone for whom this was the most important thing left to accomplish, looking at the woman who'd just pulled him back from wherever he'd been going, with an expression that said, plainly and without apology, that he knew exactly who she was and what she'd just done and what it meant. The phone in Elaine's hand made a small noise. Nobody moved. The salute held for 4 seconds, maybe 5. Long enough for everyone in the room to understand that it was not a reflex, not confusion, not the gesture of a man too far gone to know what he was doing. The soldier's arm was shaking, blood loss, pain, the effort of keeping his elbow locked. But his hand stayed flat and precise at his brow, and his eyes stayed on Claire, and the message in that held position was as clear as anything spoken aloud. Elaine Voss was the first one to move. She lowered the phone slowly, not ending the call, just dropping her hand to her side, and she looked at the soldier on the table and then at Claire, and then at the captain standing in the doorway, and the expression on her face was the expression of someone who has walked into a room mid-conversation and cannot locate the context for anything she has seen. Captain Darren Stahl stepped fully into the trauma bay. He was 37, lean in the way that field work makes people lean, with a scar along his left jaw that had healed clean but hadn't healed invisible. He moved without hesitation to the patient's bedside, took one look at the monitor, one look at the chest tube drainage, and then turned to face the room at large. "Who performed the decompression?" he asked. Nobody answered immediately. Garrett made a motion with his hand that was not quite pointing at Claire and not quite pointing at himself. Elaine's mouth opened. "She did," Marcus Webb said from near the door. His voice was quiet and flat. He was looking at his shoes when he said it, and then he looked up. "Nurse Whitmore." "She did." Stahl looked at Claire. "You stabilized him?" "Temporarily," she said. "He still needs imaging and surgical consult. The drainage output needs it to be monitored every 15 minutes, and his pressure is going to be unreliable for the next few hours. If it drops below 70 systolic again, I understand." He wasn't dismissing her. He was listening the way people listen when they already know the source is reliable. "Thank you, Major." The word landed in the room like something dropped from a height. Not loud, just heavy in a way that changed the shape of everything around it. Elaine made a sound. "I'm sorry." "Major?" Stahl glanced at her briefly. "Is there somewhere we can speak with your administration? I need about 20 minutes in a conference room." You need to explain. Conference room, please. I'll explain everything once. He looked at the two men in civilian clothes in the doorway. Stay with Kowalski. Nobody moves him until I clear it. The men nodded and came into the room. Garrett stepped back automatically to make space, the way people step back for authority they recognize even when they're not sure what form it's taking. The soldier, Kowalski, apparently, had lowered his arm. The salute was done. I was looking at the ceiling now with the particular blankness of someone letting the pain medication do its work. But his lips moved once, briefly, and Claire, who was closest, heard what he said even though it wasn't directed at her. Told them she'd be here, he said. To no one. To the ceiling. Told them. Claire turned and walked out of the trauma bay. She went to the staff bathroom at the end of the corridor, the single occupancy one that nobody used much because the lock was unreliable. She ran the water cold and washed her hands and then stood with her wet hands over the sink and looked at the drain for about 30 seconds without moving. Her heart rate was elevated. Not dramatically. She wasn't someone who panicked, hadn't been since a long time before Crestwood. But it was up, and she was aware of it the way you become aware of something you've learned to monitor. She breathed through her nose, out through her mouth, once, twice, a third time. Then she dried her hands and went back to work. She finished the shift. That surprised people later when they thought about it, that in the middle of everything that had started to unravel, Claire Whitmore went back to the medical floor and checked on Ronald Greer, who was being discharged, and completed her medication documentation, and answered a call light in bed 7, and handed off cleanly to the oncoming nurse at 7 in the morning as if the night had been unremarkable. What she didn't know, while she was doing that, was what was happening 3 floors up. Crestwood Regional's administrative wing occupied the 3rd floor, a cluster of offices and a conference room with a long table and a projector screen that got used for quarterly meetings and the occasional uncomfortable conversation with insurance representatives. At 11:40 that night, that conference room had 6 people in it. Stahl and the 2 men in civilian clothes. Hospital Administrator Brenda Kolf, who had been called in from home and had arrived with damp hair and the expression of someone who had not yet had coffee. The medical director, Dr. Felix Harwood, who was 61 and had been at Crestwood for 22 years and had seen enough in that time to know when something was moving underneath a situation that hadn't surfaced yet. And Elaine Voss. Garrett had not been included. That omission had not gone unnoticed by anyone. Stahl set a folder on the table. He didn't open it immediately. He put both hands flat on the surface and looked at Kolf first, then Harwood, and his voice when he spoke had the particular careful modulation of someone who has delivered difficult information in difficult settings enough times to have developed a method. The man in your trauma bay is Sergeant First Class Nolan Kowalski, 75th Ranger Regiment, attached temporarily to a Special Operations Advisory element out of Fort Calhoun. He was injured during a training exercise that went wrong 17 hours ago. He was supposed to be medevaced to the military hospital at Kearney, but the situation on the ground made that impossible, and your facility was the closest with trauma capability. Harwood nodded slowly. We're glad he's stable. He's stable because of one of your nurses. Stahl opened the folder. He pushed 2 pages across the table toward Kolf. Crestwood, I need you to understand something before we go any further. The woman you have working your evening shift as a floor nurse, Claire Whitmore, is not just a nurse. Elaine leaned forward slightly. With respect, Captain, whatever her military background. Major, Stahl said. Elaine stopped. Her rank is major. Was major, technically, since she separated. But the rank is the relevant context here. He tapped the pages he'd pushed forward. Major Claire Whitmore, Army Nurse Corps, attached to the 160th Special Operations Aviation Regiment for 3 years, and then to a Joint Special Operations Surgical Team for another 4. She has deployments to 3 conflict zones. She has been primary trauma nurse on over 200 combat casualty events. She helped write the advanced hemorrhage control protocols that your military hospital at Kearney currently trains to. He paused. The procedure she performed tonight, chest decompression under pressure with limited resources, she has performed that procedure under actual enemy fire, in the dark, in a moving vehicle. The conference room was very quiet. Harwood had his hands folded on the table, and he was not looking at Elaine, which was a kind of looking. Kolf picked up one of the pages. She read it for a moment. Why is she working a floor shift at a regional hospital in Nebraska? That's her choice to make. Stahl's voice didn't change. She separated 14 months ago. She wanted a quieter situation. She is entitled to that. What she is not entitled to is having her license threatened because one of your staff members felt territorial about a trauma bay. Elaine's chin came up. That is a significant mischaracterization of what happened. Whitmore entered a trauma bay she was not assigned to, took over a procedure without authorization. Without authorization, Stahl said, she saved Sergeant Kowalski's life. Your attending physician was unable to identify a tension pneumothorax in time. Major Whitmore identified it from outside the room. Dr. Garrett was in the process of. His patient's pressure was 44/26 when she intervened. The flatness in Stahl's voice was not anger. It was something more deliberate than anger. I don't know what process he was in, but it wasn't fast enough. Elaine looked at Kolf. Kolf was still reading the page in her hand. I placed a call, Stahl continued, to the Chief of Nursing Services at Walter Reed on my way here. She knows Claire Whitmore personally. She said, and I'm quoting, "If Claire tells you there's a tension pneumo, you act on it and you thank her afterward." He collected his papers. I am not here to threaten anyone or to make demands about your internal operations. I am here because Sergeant Kowalski is my man. He is alive because of one of your employees, and I want to make sure that the report that gets filed tonight reflects what actually happened, and not a version of it that ends with a decorated combat nurse losing her license. Kolf set the page down. She looked at Harwood. Something passed between them. Not words, just the particular look of two people who have worked together long enough to communicate in shorthand. We'll need time to review, Kolf started. I'm not leaving until I know Kowalski is cleared for transfer, Stahl said. You have until then. Claire learned most of this secondhand, not from Stahl, not that night. From Marcus, who had a friend in hospital maintenance who'd been buffing the hallway floor outside the third-floor conference room, and who had very good peripheral hearing, and who texted Marcus at 12:30 in the morning with a message that Marcus read twice before he went to find Claire at the nurse's station. She was writing up her final documentation notes. He sat down across from her and slid his phone across the counter without saying anything. She read the text. She read it again. Her face didn't do much. She slid the phone back. You already knew, Marcus said. Not a question exactly. I knew someone was up there, she said. I didn't know what he was saying. How are you not? He stopped. You're not surprised at all. Kowalski knew who I was the second he came in. She was looking at her documentation screen, not at Marcus. The unit's based at Fort Calhoun. I knew there was a chance eventually. A chance that one of them would end up in your ER. Yes. And you've just been, what, waiting for that? She looked up from the screen. Her expression wasn't complicated. It was just tired, the specific tiredness of someone who has explained a version of this to themselves many times and is not eager to do it again for an audience. I wasn't waiting for anything, she said. I was working. Marcus was quiet for a moment. Then he said, Elaine's still up there. I know. She's not going to let this go quietly. I know that too. So what are you going to do? Claire went back to her documentation. Finish my notes, she said. Go home. Run in the morning. He looked at her for a long moment. Then he picked up his phone and stood up. You're either the most zen person I've ever met, he said, or you're just genuinely not afraid of her. Claire didn't answer, and Marcus went back to his work, and the nurse's station was quiet again, except for the sounds of the hospital doing what it did through the early morning hours. What Claire did not say to Marcus, and would not have said to anyone, was that she was afraid of something. Not of Elaine Voss specifically, and not of the review, and not of losing the license, though that last one was close enough to the surface to be worth monitoring. What she was afraid of, the thing that had kept her awake some mornings after her run, lying on top of the covers in the pale Nebraska light, was simpler and harder to name. She had left for a reason, not one reason, several compressed together over time into something she couldn't fully unpack even alone. The work itself hadn't broken her. She was too practically wired for the work to break her. What had ground her down, slowly, and then all at once in the way those things go, was the peripheral cost of it, what accumulated around the edges of being the person who could be depended on in situations where dependence carried the highest possible stakes. The weight of other people's worst moments, carried in bulk, for years, without enough time between them. Crestwood had been supposed to be the answer to that. Small enough. Quiet enough. Nothing that would require the full version of her. Kowalski's gray eyes finding hers across the room had been a particular kind of notification that the full version of her was going to be required regardless. She'd spent 14 months trying to be only part of what she was. It worked fine until it didn't. By the time her shift ended, the hospital had the texture of a place where something has shifted, but nobody has yet announced what. The overnight staff moved through their routines with a slightly elevated alertness. The way you move when you know there's been an incident, and the paperwork hasn't caught up to the hallway talk yet. Two of the night nurses looked at Claire differently as she passed. Not unkindly, which was itself a change. She was at her locker when Priya Sundaram came in. Priya was 26, 2 years into her nursing career, with the kind of precise competence that gets overshadowed in environments that reward volume over accuracy. She'd been on the floor for part of the night. She had clearly heard things. "Are you okay?" she asked. Claire was pulling on her jacket. "Fine." "Is it true what they're saying, that you were in the Army, like Special Operations?" "Army Nurse Corps." Claire zipped the jacket. "It's a separate thing." "But you were attached to Special Operations units." "For a while." Priya leaned against the adjacent locker. She had the look of someone working up to something. "The way you moved in that trauma bay," she said finally. "I was watching through the window. I've never seen someone work like that." Claire picked up her bag. "You'll get there." "No." Priya shook her head slightly. "That's not what I mean. I don't mean technically. I mean, you weren't scared. The whole room was scared, and you just weren't." Claire considered that for a moment. "I was focused," she said. "There's a difference." She moved toward the door and stopped. "Get some sleep, Priya." She drove home in the gray pre-dawn, parked in her spot, sat in the car for 2 minutes without moving, then went upstairs. She didn't run that morning. She made coffee, sat at the kitchen table, and looked out the window at the river visible between the buildings. And she thought about Kowalski's face, and about Stahl's voice saying her rank in that room, and about the fact that the thing she'd built here, the quiet, the smallness, the deliberate reduction of herself to something manageable, was probably already over. Her phone buzzed at 8:40. Unknown number. Nebraska area code. She almost didn't answer. "Whitmore." "Major Whitmore." A woman's voice, clear, measured with the cadence of someone accustomed to institutional authority. "This is Brenda Kolf. I'm the hospital administrator at Crestwood Regional. I'd like to request a meeting this morning, if you're available." Claire set down her coffee. "About what?" "A number of things." A pause. "I want to say before anything else that I've reviewed your service record. I apologize that this conversation is happening under these circumstances." "What circumstances are those, exactly?" Another pause, longer this time, with a quality that Claire read as someone choosing words carefully. "There's been a formal complaint filed this morning by Elaine Voss, and separately Dr. Garrett has submitted an incident report." Kolf's voice remained even, but something under it tightened slightly. "I want you to be aware before you come in." Claire was quiet. "Major Whitmore?" "I heard you," Claire said. "What time?" "Whenever is convenient. I have my calendar open." 10. 10 is fine, thank you." She ended the call and set the phone face down on the table and looked at the river again. The morning light was coming in sideways, the kind of flat Midwestern light that doesn't flatter anything, but doesn't hide anything either. Elaine had filed first. That was the moves. Get the paperwork in before the counter-narrative had a chance to solidify. Claire had seen this particular dynamic before, in a different kind of institutional setting, and she understood how it worked. The person who files first controls the initial frame. Every subsequent piece of information gets read through that frame, has to work against it rather than establishing its own ground. The question was what Kolf was going to do with it. She arrived at Crestwood at 9:50. She was wearing civilian clothes, dark jeans, a gray sweater, boots. Because she was technically off duty, and because some part of her had decided that she was not going to arrive for this meeting, looking like she was making an effort to look harmless. She signed in at the front desk, took the elevator to the 3rd floor, and found Brenda Kolf's assistant waiting at the elevator bank to escort her. That was new. Claire filed it under things worth noting. The conference room had been rearranged since the night. The long table now had 5 chairs on one side and 1 on the other. Claire sat on the 1-chair side without being asked. It was a calculated thing to do. She'd been in enough briefings to know that the configuration of the room is itself a piece of information. But it came naturally, the way a lot of things that were once trained responses had stopped feeling like responses and started feeling like instinct. Kolf came in first. She was 50-something, with short, gray-streaked hair and the kind of low-level fatigue in her eyes that comes not from one bad night, but from a job that doesn't entirely stop. She sat directly across from Claire. Harwood came in next and sat one seat over. Then a woman Claire didn't recognize, 50s, gray blazer, reading glasses on a lanyard, who sat at the end and opened a legal pad. Then Elaine Voss. She came in last, which was either an entrance or a delay depending on how you read her, and she sat at the far end of the same side as Kolf, which meant Claire could see her in peripheral vision without looking directly at her. Garrett was not in the room. That absence had weight. Kolf placed her hands flat on the table. "Thank you for coming in, Ms. Whitmore." "Whitmore is fine," Claire said. "I want to begin by being direct about where we are." Kolf's tone was the institutional version of careful. Not warm, not cold, just precise. As of this morning, Nurse Voss has filed a formal misconduct complaint regarding last night's incident. Dr. Garrett has filed an incident report alleging patient safety concerns. She looked at Claire steadily. "I also have on this table the service record provided by Captain Stahl. I have a written statement from a Colonel Marta Espinoza at Walter Reed, who speaks to your qualifications in considerable detail. And I have the preliminary clinical outcome, which is that Sergeant Kowalski is alive and his condition has upgraded to serious but stable since early this morning." "He's upgraded?" Claire said. "As of 6:40 this morning." Something moved behind Claire's eyes, small and quick. She didn't say anything. "Here's my problem," Kolf continued. "I have 2 members of my staff filing complaints against a third, and that third staff member's intervention appears to have been the decisive clinical action that saved the patient's life. These facts do not sit comfortably together." She glanced once at Elaine, then back at Claire. "I want to hear, in your words, what happened." Elaine made a sound. It was not quite a word. Kolf did not look at her. Claire looked at the table for a moment, then she looked up. "I was on the medical floor. I heard the incoming call on the radio. I looked at the trauma bay through the window and identified a clinical pattern: tracheal deviation, deteriorating vitals, waveform on the monitor consistent with tension pneumothorax. I entered the bay because I believed the patient would die if I didn't." "You entered a bay you weren't assigned to?" "Yes. After being told directly by Nurse Voss not to." "Yes." Elaine leaned forward, which is a fundamental violation of— "Elaine!" Kolf's voice didn't rise, but it cut. Elaine sat back. "What was your assessment of Dr. Garrett's response at the time you entered?" Kolf asked. Claire considered the question. She knew this was a trap in multiple directions. Answer too critically and it becomes a personal attack, which could be used against her. Answer too charitably, and it contradicts the clinical reality. "He was running a differential," she said. "In a non-military setting, with a patient whose presentation was unusual, that's a defensible approach. The problem was the time constraint. Tension pneumo at that pressure level doesn't wait for a differential. And you knew that because I've seen it 40 or 50 times, roughly, in conditions where the patient didn't have the luxury of waiting." The woman in the gray blazer was writing on her legal pad. "Ms. Whitmore," Kolf said, "are you aware that Nurse Voss has requested, as part of her complaint, that your nursing license be reviewed by the state board?" Claire kept her face neutral. "I'm aware she called someone last night." "It went further than a call. There's a formal inquiry request logged with the Nebraska Department of Health and Human Services as of 7:15 this morning." Kolf held her gaze. "I want to be honest with you about what that means procedurally. Even if this hospital's internal review is resolved in your favor, the state inquiry runs on its own timeline." Elaine's posture, at the end of the table, had the quality of someone who has made a move and is waiting to see whether it lands. The room was quiet. And then the conference room door opened. It wasn't the assistant, it was Stahl, which was itself surprising because he'd said last night he was there until Kowalski was cleared for transfer, and Kowalski had apparently upgraded to stable, so the reasonable assumption was that he'd be gone. He was not gone. He was standing in the doorway of the conference room in full uniform, and he had someone with him. The woman behind him was in uniform too. Bird Colonel's insignia on the shoulder. She was 52, maybe 53, with close-cropped silver hair and a posture that made the already not small conference room feel smaller. She carried a briefcase. She did not appear to have been rushing. She looked at Kolf. "Brenda Kolf?" Kolf blinked. "Yes." "Colonel Adria Lennox, Army Inspector General's office." She set the briefcase on the table. Not heavily, just with the flat certainty of someone claiming a surface. "I understand there's been a licensing inquiry filed against one of your staff members. I need to be included in this conversation." Elaine's face went through 3 separate expressions in about a second and a half. Lennox looked at Claire. Something in her face didn't quite soften. It was too professionally set for that, but it shifted. Recognition, maybe, or something adjacent to it. "Major Whitmore," she said. Claire sat up slightly straighter. Old reflex. "I drove up from Kearney this morning when Captain Stahl called." Lennox sat down, not at the end of the table, but directly next to Kolf, which meant Kolf was now flanked by institutional authority on one side and a woman with a legal pad on the other, and the geometry of the room had changed completely. "What happened last night in your trauma bay is of direct interest to the Army, given that the patient is one of ours and the intervention was performed by a former officer." She opened the briefcase and removed a document. "I've reviewed Major Whitmore's service record. I'm also aware of the licensing inquiry filed this morning." She slid a copy of something across the table toward the woman with the legal pad. "That's a formal request from the Inspector General's office to the Nebraska DHHS requesting a 30-day hold on any license proceeding pending our review of the clinical events." Elaine said, "You can't." "It's already filed," Lennox said. She didn't look at Elaine when she said it. "It was filed 40 minutes ago." The silence in the room had a different quality now. Not the silence of a meeting in progress, but the silence of a meeting whose floor has changed. Kolf was looking at the document Lennox had slid across. Harwood was looking at his hands. Elaine was looking at Lennox with an expression that had moved past calculation into something less organized. Claire was looking at the window. Outside, the Nebraska sky was doing what Nebraska skies do in October, flat and pale and enormous, going on past what you can see. She was aware of her own breathing. She was aware of the chair under her. She was aware, at the edge of her awareness, that something that had been stable in her life for 14 months was definitively no longer stable. She had known it in the trauma bay when she stepped in, known it when Kowalski's eyes found her, known it probably before that, in some part of herself that had never quite believed the quiet was permanent. The question was what came next. Lennox placed one more document on the table. She slid it directly to Claire this time, not to Kolf, not to the woman with the legal pad, to Claire specifically. "I'd like you to read that," she said, "and then I have some things to tell you about why I'm really here." Claire looked at the document. It was a single page. Official letterhead at the top, Army Medical Command. Her name in the subject line. She picked it up. She read the first paragraph. Her hand holding the paper went very slightly still. The first paragraph of the document was 11 lines long. Claire read it in about 8 seconds, which was fast enough that she went back and read it again, slower, because some part of her wanted to be certain she wasn't constructing meaning out of institutional language the way tired people sometimes do. She wasn't. The language was plain enough. The Army Medical Command, in coordination with the Joint Special Operations Medical Training Center and the Office of the Army Surgeon General, was formally requesting that Major Claire Whitmore, separated in active reserve 14 months, be considered for reinstatement at her previous rank, with a reassignment to a newly established combat trauma curriculum development program based at Fort Calhoun, Nebraska. The program was designed to standardize advanced trauma protocols across Joint Special Operations units. The request had been pending, according to the document's date stamp, for 6 weeks. 6 weeks. While she'd been repositioning patients and drawing up medications and absorbing corrections from Elaine Voss, there had been a document with her name on it sitting in a queue somewhere inside the Army Medical Command for 6 weeks. She set the paper down. "How long have you been looking for me?" she asked. Her voice came out even, which surprised her slightly. Lennox didn't apologize for the timeline. Claire respected that. The request originated with the JSOMTC in August. Tracking your current employment took 2 weeks. After that, there was an internal discussion about approach. She folded her hands on the table. "We were aware you separated voluntarily. We didn't want to send an order. We wanted to make a case." "And Kowalski?" Lennox's expression shifted slightly. Sergeant Kowalski's unit is stationed at Fort Calhoun. I was aware of the reinstatement discussion. He had not been authorized to make contact. A pause. He was injured during a live fire exercise, not a training scenario. He had no control over where the medevac routed. But he recognized me. He knew your record. Most of the Ranger element at Fort Calhoun knows your record, Major. You treated 4 of their people during a deployment in 21. One of them is still in the unit. Lennox looked at her steadily. Kowalski coming in through your ER was coincidence. What he did in that trauma bay was not. Claire thought about the salute, the deliberateness of it, the way he'd held it despite the blood loss and the pain, like it was something he'd decided to do and was going to finish. He was making a point, she said. He was making several. Lennox glanced once at Kolf, then back. Which brings me to why I drove up from Kearney this morning instead of sending this by courier, Kolf said carefully. Colonel Lennox, with respect, this is still a hospital administrative matter. Nurse Whitmore's employment here is about to become significantly more complicated, Lennox said, which is why I'd prefer we address it in the same room. She looked at Elaine for the first time directly. It was a brief look, fully professional, and it contained nothing overtly hostile, and somehow that made it worse than if it had. The licensing inquiry filed this morning is being held. That's done. The internal complaint is a hospital matter, and I won't interfere with your process. But there are some facts on the table that I think your administration needs to hear before any decisions get made. She opened the briefcase again. She removed a second document, thicker this time, and placed it in front of Kolf without fanfare. That is Major Whitmore's complete service record, not the summary Captain Stahl provided last night. The full record. The procedures she's certified in, her performance evaluations, the after-action documentation from the deployments. Lennox sat back. I would draw your attention in particular to page 11, which covers an incident in 2020 in which Major Whitmore performed an emergency thoracotomy on a Special Forces warrant officer in an uncontrolled environment with no surgical backup and no general anesthesia. The warrant officer is currently serving as a team sergeant with the 5th Special Forces Group. She paused to let that sit. What she did in your trauma bay last night was, by comparison, straightforward. The room absorbed that. Harwood reached across and took the document from Kolf. He opened it to page 11. He read it. His expression changed in the slow way that genuine recalibration looks different from performed recalibration. The chest tube, he said quietly, not to anyone in particular. She did that in, 4 minutes? 3 minutes 40 seconds, Marcus Webb said. Everyone looked at the doorway. Marcus was standing there with the particular expression of someone who had not planned to speak but had done it anyway and was now committed. He had his phone in his hand. I was timing. I didn't know why I was timing. I timed it. He looked at Kolf. 3 minutes 40 seconds from when she picked up the tray to when she stepped back. Kolf looked at Harwood. Harwood looked at the document. Elaine said, None of that changes the fact that she violated protocol. She entered a restricted space, she took over a procedure without authorization, and she directly countermanded my instruction to a subordinate staff member. Elaine. Harwood's voice was quiet. He still hadn't looked up from the document. Felix, please. He turned to page 12. He kept reading. Elaine went silent, but her silence had the quality of something compressed rather than resolved, pressure held in rather than pressure gone. What happened next took 4 hours and involved people and phone calls that Claire was not present for, because Lennox excused her from the conference room after the first 40 minutes with the explanation that there were institutional matters to address that didn't require her presence and that she would be contacted before end of day. Claire went to the hospital cafeteria. She bought coffee and a sandwich she ate half of and sat at a corner table facing the door and watched the lunchtime crowd move through. Her phone buzzed twice. The first time was Stahl, a text. Kowalski's asking about you. She didn't answer. The second was an unknown number that left no message. She thought about the document, the reinstatement request. Fort Calhoun, which was 40 minutes from where she was sitting right now. The curriculum development program, which she knew enough about the shape of to understand that it was real work, not administrative, not ceremonial, the kind of work that had consequence downstream. She thought about what she'd been doing for 14 months instead, not with regret exactly. Regret implied she'd made a mistake, and she wasn't certain she had. She'd needed the reduction. She'd needed to be small for a while to do work that didn't require her to carry other people's survival as a direct personal liability. The problem was that the reduction hadn't fully worked, because you can reduce your context, but you can't reduce your instincts. And standing in that corridor watching Kowalski's pressure tank on the monitor, she hadn't made a decision so much as responded to something that had never actually turned off. She was on her second coffee when Priya Sundaram sat down across from her. "I'm not stalking you," Priya said. "I'm on lunch." "I know." Priya looked at Claire's half-eaten sandwich. "They're keeping Elaine up there. I heard she's been in that conference room since before 9. "I know. Is it bad? For her?" Claire considered the question. "I don't know what decisions they'll make." Priya turned her coffee cup in her hands. "Can I ask you something?" "You're going to." "Why did you come here?" "To Crestwood. With your background, you could have gone anywhere. A trauma center, a teaching hospital. Why a regional ER in Nebraska?" Claire looked at the table. It was a fair question, and she'd given versions of the answer to herself enough times that she had something resembling a clean response, though it never felt quite complete. "I wanted somewhere that didn't need everything I had," she said. "I wanted to be useful without being critical." "But you were critical last night." "Yes." "So it didn't work." "Not entirely," Claire said. "No." Priya nodded slowly. She seemed to be processing something. "For what it's worth," she said, "the way you talked to me about the IV placement 2 months ago, that was the clearest technical explanation anyone has ever given me. And you weren't trying to impress anyone. You were just explaining the thing." Claire looked up. "That's the kind of teaching that actually sticks," Priya said. "I don't know what they're offering you up there, but I think you'd be good at passing it on." She picked up her coffee and left. Claire sat with the empty table for a while. The call from Kolf came at 2:17. "Can you come back up?" Kolf said. "There's been a development." The development was Owen Garrett. He was in the conference room when Claire arrived, which she hadn't expected. He was sitting at the table with his hands in front of him, and the expression of someone who has been in a room with difficult information for long enough that the difficult information has started to settle into him. He looked up when she came in. He didn't look away. Lennox was still there. Harwood, Kolf, the woman with the legal pad, whose name Claire still didn't know. Elaine was not in the room. That absence was loud. Kolf gestured to a chair. Claire sat. "Dr. Garrett has made a statement," Kolf said. "I'd like him to share it with you directly, if he's willing." Garrett looked at his hands. Then he looked at Claire. "I've withdrawn the incident report," he said. His voice was flat in the way voices get flat when someone is working to keep them steady. "What I filed this morning was a response to the situation, not an accurate account of it. And that's—" He stopped, started again. "I had a patient crashing, and I was running a differential when I should have been moving faster. You identified it before I did, from outside the room." He exhaled. "The incident report implied you created a patient safety risk. That's not what happened. I created the patient safety risk. You corrected it." The room was quiet. "That took something," Claire said. She meant it. It wasn't absolution. One statement didn't rewrite the texture of how he'd operated for the 2 years she'd worked under him. But she wasn't going to pretend it didn't cost him something to say it in this room with these people present. He looked at her with an expression she couldn't entirely read. "I didn't know who you were," he said. "It shouldn't have mattered." "No," he said it quietly. "It shouldn't have." Kolf let the silence run for 3 seconds, then moved forward. "Given Dr. Garrett's withdrawal, the internal patient safety complaint is resolved. The licensing hold from Colonel Lennox's office addresses the state inquiry." She folded her hands. "What remains on the table is Nurse Voss's misconduct complaint, and I want to be direct about where we are with that." "Where are you?" Claire asked. Kolf looked at Harwood briefly. "Elaine Voss has been with this hospital for 11 years. She is a thorough and effective administrator of nursing services. She is also—" Kolf paused, and Claire could see her choosing language the way you choose your footing on uncertain ground. Someone whose management of subordinate staff has generated complaints over time that were addressed individually rather than as a pattern. She looked directly at Claire. "I've spent the last 2 hours reviewing your personnel file. Not the clinical record, the administrative one, the correction logs, the reassignments. The scheduling changes. Her voice was even, but something under it had sharpened. It's a pattern. Claire didn't say anything. I owe you an apology, Kolf said. As hospital administrator, whatever else happens with the board, with the army, with any of this, within these walls, you were not treated the way we should treat staff. And that's on me as much as it's on Elaine, because my job is to know what's happening on my floors. The woman with the legal pad was writing. Lennox was watching Claire with the particular attention rather than reacting. Claire said, "What's happening with Elaine now?" "She's been placed on administrative leave pending a full review." Kolf's voice didn't waver. "Given the volume and the pattern, I expect that review will result in termination. I'm telling you that directly because you deserve to know, not because I need your input on the outcome." That was the right way to say it. Claire noted it. "I have one more thing," Lennox said. She looked at Garrett. "Dr. Garrett, thank you for your statement. I think we're done with what we need from you." Garrett nodded. He stood, looked at Claire one more time with that unreadable expression, and left. When the door closed, Lennox reached into the briefcase for the third time. She removed a single page and slid it to Claire. "That's the formal reinstatement offer," she said. "Full document, not the summary. You don't have to answer today. But I want to walk you through what the role actually entails, because the summary doesn't capture it." She spent 20 minutes doing that. Claire listened. She asked 3 questions, all of them procedural, all of them specific, and Lennox answered each one without inflation or evasion. The curriculum development program was real, joint funding, actual authority, direct pipeline to training standards. The reinstatement would restore her record as it stood at separation. The work would require her 3 days a week at Fort Calhoun and leave the other 4 days uncommitted. "You could maintain civilian employment," Lennox said, "if you wanted. At Crestwood. Wherever you wanted, that's your choice." She looked at Claire levelly. "The Army is not asking you to come back to what you left. The program is different work, but it uses what you have." Claire looked at the single page. She didn't pick it up. "I need to think," she said. "I know." Lennox stood. "You have my number. Call when you're ready." She drove back to her apartment. She didn't go inside immediately. She sat in the parking lot with the engine off and watched a pair of Canada geese walk across the far end of the lot, with the supreme indifference of large birds who have assessed their environment and found it non-threatening. Her phone rang. She looked at the screen. Fort Calhoun Military Clinic. She answered. "Major Whitmore." A different voice. Younger. She didn't recognize it. "This is Specialist Tara Reyes. I'm Sergeant Kowalski's unit admin. He asked me to call. He wanted you to know he's been moved to the clinic, and he's doing better. He said," a pause, the sound of someone reading something off a paper, slightly self-conscious about it. "He said to tell you the drainage is within normal parameters, and his O2 sat is 96%. Claire almost laughed. Almost. "Tell him I said that's acceptable," she said, "and that he needs to sleep." "Yes, ma'am." Another pause. He also said, and I'm just reading this, "She knows what she's doing, the whole thing. Tell her." Claire was quiet. "That's all he wrote," Reyes said. "I'm not sure what it means." "I know what it means," Claire said. "Thank you, Specialist." She ended the call. The geese had reached the far fence and were working their way along it with total conviction, like they had somewhere specific to be and were not particularly concerned about the timeline. She sat there for another 10 minutes. Then she went inside. She put the kettle on. She looked at the river through the window. She thought about Priya saying the kind of teaching that actually sticks. She thought about Kowalski's hand rising from the mattress in the wreck of the trauma bay. She thought about herself 14 months ago, signing the separation paperwork in an office at Fort Bragg, telling herself she was choosing something different, not running from something, and knowing even as she told herself that the distinction was maybe not as clean as she needed it to be at the time. She picked up the reinstatement document from the kitchen table where she'd set it, read it again properly this time, all the way through, every clause. Then she set it down and reached for her phone. She stopped. Because her phone was already ringing. Different number. Not Stahl, not the clinic, not Kolf. A 202 area code she didn't recognize. Washington. She picked up. Whitmore. Major Whitmore. A man's voice, measured, careful, with the specific cadence of someone who is being careful on purpose. "My name is Warren Bale. I'm with the Army Inspector General's Criminal Investigation Division. A brief pause. I need to speak with you about Colonel Lennox. Claire's hand tightened on the phone. I'm listening, she said. Not on the phone, Bale said. There's a situation developing that you need to be aware of in person. I can be at your location within 3 hours. Another pause, shorter. Major, I need you to not make any decisions regarding the reinstatement offer until we've spoken. That's important. Why? A long pause, long enough to mean something. Because the program you've been offered, Bale said slowly, is not what Colonel Lennox told you it was. The 3 hours Bale had said became 2.5. Claire used the time the way she'd learned to use waiting time, not to speculate, but to prepare. She made a second pot of coffee she didn't entirely drink. She pulled out a legal pad and wrote down, in plain language, everything Lennox had told her about the program, every claim, every specific detail, and then she looked at the list and thought about which items were verifiable and which ones she had simply accepted because they'd been delivered with authority in an institutional setting by a person in a colonel's uniform. She'd accepted most of them. That bothered her. Not because she thought she should have been suspicious in that conference room. Suspicion without cause was its own kind of dysfunction, but because she knew herself well enough to know that the offer had landed in a place she hadn't adequately defended. The part of her that had wanted something purposeful, something that used what she was, had opened the door before her judgment had fully checked who was knocking. She wrote that down too. Not as self-criticism, as data. Bale arrived at 4:40. He was 50, or looked it, medium height, a plainness to his build and his clothes that read as deliberate rather than accidental, the kind of person who has learned to be easy to not notice. He showed credentials at the door before she asked. CID, as he'd said, Washington Field Office. The photograph matched the face. She let him in. She didn't offer coffee. He didn't ask. He sat at her kitchen table and he put a folder on the surface between them, but didn't open it, and he looked at her the way people look when they're deciding how much to lead with. How much do you know about Adria Lennox? He asked. Before today? Nothing, Claire said. I've never worked with her. She came to the meeting this morning with Captain Stahl. She had credentials and documentation, and she was clearly known to the hospital administration. I had no reason to question her presence. Bale nodded slowly. She's a real colonel, he said. Active duty, Inspector General's office, as she stated. That part is true. He opened the folder, turned it so she could see the top page. What is not true is that the reinstatement program she presented to you originates with the Army Medical Command. Claire looked at the page. It was an internal memo, CID formatting, routing numbers, the kind of document that is dense with institutional language and takes a moment to locate the operative sentence in. She found it. Read it twice. The program request was drafted by Lennox's office, she said. Yes. Not by the Surgeon General's office. Correct. The letterhead on the document she gave you is genuine. The routing through the Surgeon General's office is backdated and fabricated. We've confirmed that with the actual Surgeon General's staff as of 9 o'clock this morning. He turned to the next page. The JSOMTC, the Joint Special Operations Medical Training Center, they do have a curriculum initiative running. It's real. But Major Whitmore is not in it. Your name was inserted into their program documentation without their knowledge, using Lennox's access to the joint document system. Claire set down the page. She looked at the wall for a moment. Why? She said. That's what I need your help understanding, Bale said. Because from where we're sitting, Lennox had a specific interest in getting you to Fort Calhoun in a structured role. She engineered the paperwork to make it look like the request came from multiple institutional sources. She filed the licensing hold with the state this morning. That part is within her actual authority. But she used it as leverage to smooth your path toward accepting the offer. She was removing obstacles, Claire said. Elaine's complaint, the state inquiry, Garrett's incident report. She neutralized all of them this morning. Yes. Which means she needed me compliant and grateful and without active threats to my license. Claire looked at the folder. What does she actually want me at Fort Calhoun for? Bale turned to the third page. We're not entirely certain yet, but I can tell you what we know. He tapped the page. There is a classified after-action review currently underway at Fort Calhoun related to the training exercise in which Sergeant Kowalski was injured. The injury was not, as Lennox told you, a live fire accident. There was a protocols failure, a cascade actually, starting with improper medical clearance of a participant who had a pre-existing condition that should have grounded him. He met her eyes. The initial medical clearance was signed off by the Fort Calhoun Clinic's senior medical officer. Lennox has authority over that officer's evaluation. She is, in plain language, managing an investigation into a preventable serious injury, and she has authority over the people being investigated. Claire sat back. She wanted me at Fort Calhoun to consult on the curriculum, to consult on the medical protocols specifically, the same protocols that failed during the exercise. Because if I'm the outside expert who validates the existing protocols as sound, then the cascade becomes a training failure rather than a protocols failure, which is a very different kind of institutional liability. Bale said it without editorializing. Just the fact, laid flat. Your record is impeccable. You helped write the original protocols. If you review them and find them adequate, that carries extraordinary weight in the after-action. The kettle was still warm on the stove. Claire got up and poured herself a cup she didn't need and stood at the counter for a moment with her back to Bale and the folder and the flat October light coming through the window. She had been, she understood now, a very specific tool. Not random, not coincidental. Lennox had identified her months ago, had tracked her to Crestwood, had waited for a moment of institutional vulnerability, a licensing threat, a complaint, a situation where clearing Claire's path would look like advocacy, and had used that moment to position her. The intelligence of it was almost worth acknowledging. Kowalski, she said without turning around. Does he know? We don't believe so. Sergeant Kowalski's knowledge of the reinstatement discussion was limited. He was told by someone in his unit that there was an offer in the works. We think that information came through unofficial channels and was genuine, meaning at some point the JSOMTC was actually considering your name. Lennox appears to have taken a real possibility and weaponized it. Claire turned around. The salute, she said. He wasn't performing. He genuinely believes you saved his life and genuinely respects your record, Bale said. There's no indication he's part of this. He's a patient who happened to recognize a former officer in an ER. He paused. He's also, incidentally, one of the witnesses to the protocol's failure during the exercise, which Lennox knows. That added another layer. If Kowalski was a witness to the failure and Claire was brought in as the validating expert, the combination created a closed loop. The witness's credibility anchored to the expert's credibility, both pointing away from Lennox's officer. She's thorough, Claire said. She's been doing this for a while, Bale said. This is not the first time she's managed an investigation from the inside. It's the first time we've been able to document the paper trail clearly enough to move on it. He looked at her directly. Which is where you come in, if you're willing. Claire set down the cup. What do you need? We need you to accept the offer. The room was quiet for a moment. You want me to go to Fort Calhoun, Claire said. We want you to accept Lennox's offer, yes. Go to Fort Calhoun, review the protocols. And when Lennox's people come to you with the specific framing they want, and they will, because that's how this works, they'll tell you what conclusions they're hoping for. We need you to document exactly what you're asked to do and how you're asked to do it. He slid a fourth page across the table. The actual review would still be yours. We're not asking you to falsify anything. We're asking you to do the job accurately, document the pressure you receive to do it inaccurately, and provide that documentation to us. And the real protocols review, Claire said, the actual findings, would go on record as written, whatever they are. If the protocols are sound, then they're sound, and the after-action reflects that, Bale said. We are not asking for a predetermined outcome. We are asking for an honest process with a witness. Claire looked at the fourth page. It was a formal cooperation agreement, CID letterhead, her name in the subject line, sparse and precise in the way legal documents are precise when they're written by people who know what they need and don't want ambiguity creating problems later. If I do this, she said, Lennox cannot know. Correct. Which means the meeting this morning, my apparent willingness to consider the offer, has to hold. She needs to believe I'm moving toward yes. Yes. And Stahl? Bale hesitated for just a fraction of a second. Captain Stahl is being interviewed separately. We don't believe he's involved in the misconduct, but we're not sharing the full scope of the investigation with anyone at Fort Calhoun at this stage. Claire thought about Stahl's face in the trauma bay doorway. The relief in it when he'd seen Kowalski's pressure stabilizing. That had been real. She'd been reading people under stress for long enough to know the difference between genuine and performed. Whatever Stahl knew or didn't know about Lennox's operation, his concern for his soldier had been real. That mattered, not enough to change the calculation, but enough to note. "Give me until tomorrow morning," she said. Bale nodded. He didn't push. "One thing," he said as he gathered the folder. "The licensing hold Lennox filed. It's real, it's active, and it has her name on it. If she withdraws it for any reason, the state inquiry reopens. She won't withdraw it as long as she believes you're moving toward the offer." He looked at her. "Just so you understand the full picture." "I understand it," Claire said. He left. She listened to his car start in the parking lot below and pull out, and then the apartment was quiet, with the particular quiet of a space where a significant conversation has just ended and the air hasn't settled back yet. She went to the window. The river in the late afternoon light was flat and gray, reflecting a cloud cover that had moved in while she'd been sitting at the table. She looked at it for a long time. She called Stahl at 6. "I wanted to let you know I'm considering the offer," she said. No preamble. Stahl didn't need preamble. A pause. "Colonel Lennox spoke with you this morning." "She did. I have some questions about the program structure. Is there someone at the JSOMTC I could speak with directly?" Another pause, slightly longer. "I can get you a contact," he said. "Give me a day." "That's fine." A beat. "How's Kowalski?" The quality of Stahl's pause changed. The previous ones had been processing pauses. This one was something different, warmer maybe, or relieved in a way that had nothing to do with institutional maneuvering. "Complaining about the food," he said, "which means he's going to be fine. Tell him to sleep." "He won't, but I'll tell him." A pause. "Major, for what it's worth, what you did last night, that was, I don't have a word for it that doesn't sound inadequate." "I did what was in front of me," Claire said. "I know, that's the word I'm missing." He was quiet for a moment. "I'll get you that contact tomorrow." She ended the call. She had told him nothing false. She had told him she was considering the offer, which was true. She was considering it as an operational context, which was a different kind of consideration than what he likely imagined, but was not a lie. She had asked about the JSOMTC contact, which served two purposes. It would look to Lennox's network like due diligence from a cautious candidate, and it would tell her something about which names Stahl provided and whether any of them showed up in Bale's documentation. She was already thinking like she was back in it. She noticed that, wasn't sure how she felt about it. The next morning, she called Bale at 7:40 and told him she would cooperate. He asked no questions beyond confirming she understood the process. She said she did. He said he would be in contact with next steps within 24 hours. At 8:15, Brenda Kolf called. "I want to update you on the Voss situation," Kolf said. "Her administrative leave is converted to termination effective today. The Board of Review met this morning. They had enough in the pattern documentation to move without waiting for the full 30-day process. Her access to hospital systems has been revoked." Claire had expected this, had seen it coming since the conference room, but the actual arrival of it had a weight she hadn't anticipated. Not satisfaction exactly. Something more like the feeling after a long tension releases. Not euphoria, just the absence of a pressure that had been so constant she'd stopped registering it as pressure. "Thank you for telling me directly," she said. "There's one more thing," Kolf said. "This is separate from the Voss matter. I'd like to discuss your position here. Given what's happened, given your record, I want to offer you the option of moving to trauma coverage full-time, with a commensurate adjustment in role and compensation. That's separate from whatever you decide about the Army situation. I'm not trying to compete with that. I just want to make sure you know the offer is there." She paused. "You're exactly the kind of nurse this department should have been building around." Claire looked at the river. "I'll think about it," she said. "That's all I'm asking." She spent the morning at home. She reorganized the kitchen, which needed it, and she ran her usual route along the river, longer than usual, and she let her mind do what it needed to do when she wasn't managing it, which was to sort. She was 38 years old. She had separated from the Army because the cumulative weight of high-stakes work had hit a level she couldn't responsibly carry without a break. The break had been real. She'd needed it, and she'd taken it, and she didn't regret it. But Priya had said something that was sitting in her now. The kind of teaching that actually sticks. Not the procedure. The way the procedure is taught. The difference between someone who can do something and someone who can pass it on clearly enough that the doing happens even when they're not in the room. That was the work that kept earning after you stopped. That was the thing she hadn't found a way to do in 14 months at Crestwood, not because the opportunity hadn't existed, but because she'd kept herself too small to occupy it. The Lennox situation was going to complicate the next several months significantly. She was clear-eyed about that. Operating inside an investigation, maintaining a performance of cooperation with someone she now knew was running a corrupt process, doing the actual clinical work accurately and honestly while Bale's team built their case. That was not quiet. That was the opposite of quiet. But the work underneath it, the actual protocols review, whatever it revealed, was real. The JSOMTC curriculum initiative was real, and when Lennox's operation collapsed, as it was going to, the work would still be there. She got back from the run at 10:20. She showered, made coffee, sat at the table with the legal pad. She started writing notes about the Fort Calhoun protocols. From memory, from what she knew of the 2019 revision she'd contributed to, from what Bale had described about the Cascade failure. She wasn't reviewing yet. She had no access to the documents. But she was mapping what she knew against what she'd been told, looking for the gap where the failure would most likely live. She found it in 40 minutes. The gap was in the medical clearance pre-screen. The 2019 protocol had a provision allowing senior medical officers to expedite clearance for personnel with previous clean records if the training timeline was compressed. It was meant for scheduling efficiency. What it created in practice was a mechanism by which a pre-existing condition documented in a previous deployment's medical record, a record housed in a different system, not automatically surfaced by the expedited screen, could be missed. Not by accident. By design of the expedited pathway. She wrote it out. 3 pages, precise and organized, the kind of documentation that was both a clinical finding and, as it happened, a blueprint for exactly the kind of analysis that would make Lennox's preferred framing impossible to sustain. She was on the 4th page when her phone rang. Lennox. "Major Whitmore," Lennox said. Her voice was the same as it had been in the conference room, measured, authoritative, with a warmth that was professional rather than personal. "I wanted to check in. I know yesterday was a great deal to process." "It was," Claire said. She kept her voice neutral and slightly tired, which wasn't difficult because she was in fact tired. "I've been thinking about the offer." "Of course, take whatever time you need." A pause, brief and smooth. "I did want to mention, there's a preliminary meeting at Fort Calhoun next week. Informal, just an introduction to the team and a look at the facility. No commitment required. I thought it might help you get a sense of the environment before you make a decision." "That sounds reasonable," Claire said. "Wonderful." Something in Lennox's voice eased slightly, almost imperceptible, but Claire was listening for it. "We'll plan for Wednesday. I'll have my office send the details." "I'll be there," Claire said. She ended the call and sat with the phone in her hand for a moment, and thought about Lennox in that conference room, sliding documents across the table with the confidence of someone whose architecture was invisible to everyone in the room. The way she'd neutralized Elaine's complaint and Garrett's report and the state inquiry in a single morning, each move serving double duty, solving Claire's immediate problems while building the conditions for what Lennox actually needed. It was competent. It was also, now that the architecture was visible, completely constructed. Every piece of it placed to achieve a specific outcome, dressed up to look like institutional process and bureaucratic advocacy. Claire looked at her legal pad. 4 pages of notes on a protocol's gap that Lennox needed to stay invisible. She picked up her pen and wrote Wednesday at the top of the next page. Then she wrote, below it, a single line. What she knows versus what she thinks I know. That gap, between those two things, was the entire operational space she had to work in. Bale needed time to build the case. Lennox needed to believe the offer was working. Claire needed to be at Fort Calhoun doing the actual review accurately while performing the role of a cautious but persuadable candidate without tipping anything in either direction. She had done more complex things in more difficult environments. She knew that. But those had been environments where the threat vectors were physical and visible, and the rules of engagement were at least notionally clear. This was institutional, slower, The damage was done in paper and meetings and carefully managed impressions, and the cost of a mistake was measured in careers and records and the safety of soldiers who went through training built on compromised protocols. Kowalski's face rose in her mind. The held salute, the shaking arm. She closed the legal pad. Her phone buzzed. Text from an unknown number, different from the one Bale had called from. 4 words. Check your email now. She went to her laptop. Her inbox had one new message, sent 6 minutes ago from an address she didn't recognize, with a subject line that was a case file number in standard CID format. She opened it. The email contained a single attachment. She opened that. It was a personnel record, active duty, senior NCO rank, a name she didn't know, Master Sergeant Dale Fontaine, Fort Calhoun, currently assigned to the medical training cadre. She scrolled. Halfway down the second page, her eyes stopped. Fontaine had been the senior medical NCO on duty during the training exercise when Kowalski was injured. His name was on the expedited clearance that had been processed the morning of the exercise. His signature, specifically. The signature that had moved the injured participant through the screen that should have caught the pre-existing condition. She scrolled further. And there it was. A transfer record, dated 3 weeks ago, before Kowalski's injury, before any of the events of the last 48 hours, before Bale's call. Master Sergeant Dale Fontaine had been quietly moved from Fort Calhoun to a training installation in Georgia. Transfer authorized by Colonel Adria Lennox. Claire stared at the screen for a long time. Lennox hadn't just managed the investigation from inside. She had moved the signatory witness out of the jurisdiction before the after-action had formally opened. Fontaine was in Georgia. His physical presence, his personnel file, his records, all of it now under a different command's administrative control, which meant accessing it required inter-command coordination and created friction and delay in exactly the places where Lennox needed friction and delay. Claire picked up her phone. She called Bale's number. He answered on the second ring. "Did you send me something?" she asked. "I don't know what you're referring to," he said, which was not quite a no. "A personnel record." A pause. "Major Whitmore, I need to ask you, what email address was that sent to?" She told him. A longer pause. Then, "That didn't come from us." The apartment was very quiet. "Then who?" she started. "I don't know yet," Bale said, and his voice had changed register in a way she hadn't heard from him before. Not panic, but the particular sharp alertness of someone who has just understood that the situation has a variable they didn't account for. "Where are you right now?" "Home." "Stay there. I'm going to make some calls." He paused. "Don't respond to that email. Don't forward it. Don't delete it." Another pause. "And Major, if anyone contacts you in the next hour who isn't me or a number I've given you, do not confirm anything." He ended the call. Claire set the phone down. She looked at the laptop screen. Fontaine's name, Lennox's signature on the transfer. If this hadn't come from Bale's team, there were 2 possibilities. Someone inside Lennox's operation was leaking, a risk she hadn't calculated for, which meant the architecture wasn't as solid as it appeared. Or someone else entirely was running a parallel track with their own interest in this investigation, their own angle, their own read on what Claire's position in the middle of it was worth. Neither possibility was simple. Both of them changed what Wednesday at Fort Calhoun looked like. She closed the laptop. She sat in the quiet of the apartment and looked at the river through the window and understood, with the particular clarity that comes not from analysis, but from something more physical, more trained, that she had walked into something considerably larger than a corrupt colonel managing a bad after-action. The question was who else was walking in it with her. The answer came at 11:14 that night. Bale called back. His voice had the quality of someone who has spent 4 hours making calls and has arrived at a place he wasn't expecting to arrive. "The email came from inside Fort Calhoun," he said. "We've traced the send address to a terminal in the administrative wing of the medical training cadre. We don't know yet who sent it, but we know the building." "Someone inside Lennox's operational radius," Claire said. "Yes. Which means either she has a problem she doesn't know about yet, or someone in that building is trying to communicate something to you specifically and didn't want to come through official channels." A pause. "There's a third possibility. Someone is testing whether I'll pass information up the chain. Yes. He said it without editorializing, which she appreciated. I want to move the timeline up. Wednesday is too much exposure if there's an unknown variable inside the facility. I'd like to brief you in person tomorrow. Fort Calhoun, not here, because I need you seen arriving there naturally. Can you drive out in the morning? What time? 9. I'll meet you at the main gate as a credentialed escort. As far as anyone watching is concerned, it's a pre-visit orientation. And Lennox? Her office will be notified that you requested an early walkthrough. Her assistant will log it as candidate diligence. He paused. It'll actually look good, like you're eager. Claire said nothing for a moment. She was looking at the closed laptop. Fontaine's name still in her memory. The signature, the transfer date, 3 weeks before the injuries after action opened. One more thing, she said. Fontaine, the NCO, she moved to Georgia. We're working on access. The expedited clearance he signed, but is there a digital copy on the Fort Calhoun system, or did it migrate with his transfer? Bale was quiet for 2 seconds. That's a good question, he said slowly. I'll find out tonight. If it migrated, she controls the copy. If it stayed on the Fort Calhoun system, the digital timestamp predates her authority to modify it. Claire kept her voice even. That's either the anchor of your case or it's already been handled. You should know which one before I walk in there. Another pause. Longer. I'll have an answer by 8, he said. She went to bed at midnight and slept for 6 hours, which was more than she expected. She was up before 6, ran the short route this time, made coffee, and stood at the window in the gray early light thinking about Fontaine's signature. It was the kind of thing that looked like a bureaucratic detail until you understood what it anchored. One signature, in the right place, at the right time, was the difference between a protocol's failure that exposed a systemic problem and a scheduling anomaly that got buried in a transfer file in Georgia. Lennox understood that. That was the whole architecture. Identify the single pressure point. Control it. Everything else flows from that control. Bale called at 7:58. The clearance document is on both systems, he said. The Fort Calhoun copy has a creation timestamp from the morning of the exercise. The Georgia copy, the one that migrated with Fontaine's transfer, shows a modification timestamp from 4 days after the exercise. Someone accessed it and made changes. What changes? The pre-existing condition notation that should have triggered a hold was removed from the Georgia copy. The Fort Calhoun original still has it. They didn't get to the original. Claire set down her coffee. They didn't know there were 2 copies. Apparently not. The system creates a redundant local backup when personnel records are transferred. It's an automatic function. It's not visible in the transfer log unless you know to look for the backup directory. His voice had the particular energy of someone who has been up most of the night working toward a specific answer and has just found it. We have the original. We have the modified copy. We have a modification timestamp that falls after Lennox authorized the transfer. That is documentary evidence of records falsification. Is it enough? It's enough to open a formal investigation with the Inspector General's office over Lennox's head, which we've already done. The filing went in at 6 this morning to the Deputy Inspector General in Washington. He paused. There's going to be an investigative team at Fort Calhoun today. Not mine, above mine. I need you to go in this morning as planned, behave as planned, and let the process run. When the team arrives on site, they'll want to speak with you. I'll be there, she said. Autas. She drove out to Fort Calhoun on roads that were flat and gray under an October overcast, the kind of Midwestern morning that has no drama in it, just a vast practical plainness stretching in all directions. She'd been on this drive before. The base was 40 minutes on roads she knew. But this time the landscape felt different in a way she couldn't fully articulate. Less like background, more like the last stretch before an arrival that had been in motion she now understood for much longer than 2 days. Bale met her at the main gate. He signed her in as candidate for the curriculum consultation program, walked her through the check-in process without any visible urgency, and they walked across the installation toward the medical training building with the unhurried pace of a routine orientation. The base had the specific quality of early morning military installations, purposeful movement everywhere, nobody idle, the air carrying the slightly metallic tang of vehicle exhaust and cut grass, and something institutional underneath. The team lands at noon, Bale said quietly, not looking at her, in the tone of someone commenting on the weather. They'll stage at the JAG office. Lennox will be notified at 11:50, 10 minutes before they arrive, which is standard procedure and also not enough time to do anything useful. Does she know yet? Not yet. He held a door open. She's scheduled to meet you at 10:30 for the facility walkthrough. Claire walked through the door. So I'm sitting across from her for 45 minutes, knowing what's coming. Yes. That's going to require some work. You've done harder things, he said. She had. That was the honest answer. She'd sat in vehicles and buildings and medical stations knowing that decisions were moving toward her from outside her control, knowing that she needed to hold the surface of herself steady, regardless of what was happening underneath. The internal condition and the external expression as separate managed systems. She'd learned that skill out of necessity in environments where losing control of either had consequences she couldn't afford. This was different in texture. The environment was clean and institutional, no physical threat, no sound she needed to track. But the stakes were real. Lennox's operation, if it survived the next several hours, would continue to corrupt the protocols that governed how soldiers got cleared for training that could kill them. Kowalski was the visible version of that cost. He was alive because of an accident of routing and the presence of one specific nurse in one specific ER. The next one might not be. That was what she held on to, walking through the corridor of the medical training building with Bale and the installation's public affairs escort who had attached herself at the entrance. Not justice in the abstract. The next Kowalski. Concrete, specific. Worth 45 minutes across a table from Adria Lennox. Lennox arrived at this conference room at 10:28, which was 2 minutes early, which told Claire something about her current state of mind. She was in full uniform, same as yesterday, same measured authority in her posture. But there was a fractional quality of heightened energy in the room that she was working to project as enthusiasm. Major Whitmore. She sat across the table and smiled with the warmth she'd deployed yesterday. I'm glad you came out early. It shows initiative. I wanted to understand the facility before Wednesday, Claire said. I think better when I can picture the physical environment. Absolutely. Lennox opened a folder, different one from yesterday, thicker. I thought we'd start with an overview of the curriculum structure and then do a walkthrough of the training spaces. The protocols review would be based primarily in the medical records archive, which I can also show you today if you have time. The protocols review, the medical records archive. The room where the original clearance document lived, time-stamped and unchanged, with its notation of a pre-existing condition that the modified Georgia copy had erased. I'd like to see the archive, Claire said. Of course. Lennox looked satisfied in a way that was almost imperceptible. The candidate was engaging with the right things, everything moving as planned. They spent 20 minutes on the curriculum overview. Claire asked genuine questions, not performed curiosity, actual questions, because the work was real and she intended to understand it regardless of how the investigation resolved. Lennox answered with fluency that suggested she'd prepared for this meeting, and Claire noted which answers were specific and which were smooth in the way of answers that have been built to redirect rather than inform. The walkthrough of the training spaces took 30 minutes. The building was well designed, better than most installations she'd worked in, with simulation bays that had real equipment rather than the outdated mock-ups she'd trained on early in her career, and a clinical documentation system that was current and well integrated. The actual infrastructure of the program was solid. That had been Bale's point. The JSOMTC initiative was real, the resources were real, and Lennox had attached her operation to something legitimate precisely because the legitimacy made the corruption invisible. She was thinking about that, about how corruption most often doesn't replace legitimate systems but grows inside them, when they reached the medical records archive. It was a room, not dramatic, a room with servers and terminals and a printed sign on the door about access credentials. A woman in civilian clothes at a desk who checked Claire's temporary badge and Lennox's credential and logged both in a physical binder. Lennox stood at one of the terminals and pulled up the training cohort database. This is where the pre-deployment clearances are housed, she said. Each record links to the individual's medical history, the screening results, the authorizing signature. The new curriculum would involve building a standardized review process that sits above this existing structure. Claire looked at the screen. She could see the database architecture, the fields, the record types, the date structures. She could see, in the left column of the main display, the training cohort from the exercise period 6 weeks ago, Kowalski's cohort. "Can I see a sample record?" she asked, to understand what the review process would be working from. Lennox looked at her for a moment, just a moment. "Of course," she said. "We'd pull a redacted record for review purposes." She navigated to a record and pulled up a redacted display. Claire looked at it. She kept her face neutral and her body language that of someone learning a system, which was the simplest available cover because it was almost entirely true. She was learning the system. The clearance field in the sample record was clean. No notation of any pre-existing condition. The record had been selected, she understood, because it was clean, because Lennox or someone in her network had anticipated that a candidate reviewing the archive would be shown a sample and had prepared a sample that told the right story. What Lennox didn't know, couldn't know, was that the Fort Calhoun system had an automatic backup directory that she hadn't controlled, couldn't control, because it wasn't visible in the standard interface. Claire looked at the screen and thought, "You almost had it, the whole thing, almost." Her phone buzzed in her pocket. She looked at Lennox. "Sorry, do you mind?" "Of course not." She stepped back from the terminal. The text was from Bale's number. One word, noon. She put the phone away. She looked at the archive room around her, the servers, the terminals, the civilian archivist at her desk who had logged their entry in a physical binder. A physical binder. Paper. With a pen, low-tech redundancy in an otherwise digital system. That physical log, she realized, was also evidence. Every access, every name, every timestamp, written by hand and stored in a room that predated the investigation. "Major Whitmore?" Lennox was watching her with professional patience. "Sorry," Claire said. "I was thinking about the review architecture." She moved back to the terminal. "You'd want the review to be backward compatible with existing records, right? Not just prospective." Lennox's expression flickered almost imperceptibly towards something more careful. "The initial scope would be prospective, but for institutional accountability, you'd need the review to cover the recent cohorts as well," Claire said. Not aggressive, conversational. The tone of a professional thinking out loud. "Otherwise, you have a gap in the data, a curriculum built on an incomplete baseline." "That's a reasonable concern," Lennox said. Her voice was measured. "We'd work through the scope in the planning phase." "Of course," Claire said. She nodded at the screen. "That makes sense." She let it drop. She had not accused anyone of anything. She had simply voiced, clearly and in Lennox's presence, a position that was now on the record, that a genuine protocols review required backward-looking scope. When the investigation team arrived at noon when they asked what had been discussed during this walkthrough, Claire could say accurately that she had advocated for comprehensive retrospective review and that the response had been a deferral. Lennox closed the terminal. "Shall we head back to the conference room?" "Sure," Claire said. At 11:50, they were back at the conference table. Lennox's phone rang. She glanced at it, frowned slightly, the frown of someone whose schedule has produced an unexpected item, and said, "Give me a moment." She stepped out. Claire sat in the conference room alone and listened to the installation around her. Somewhere outside the building, on the other side of the installation, a team from the Deputy Inspector General's office was arriving. She didn't need to see it to know what it looked like. The vehicles, the credentials, the particular organizational gravity of a formal investigative arrival that everyone in its path could feel before they could explain why. Lennox came back in 4 minutes. She sat down. Her posture was the same, her expression was the same. She had the extraordinary self-control of someone who has been managing institutional situations for long enough that composure has become a reflex rather than an effort. But her hands were different. She placed them flat on the table and they were flat with effort. The specific stillness of hands that have been told to be still. "There's a matter I need to attend to," she said. "I'm going to have my assistant take over the rest of the orientation. Colonel Lennox." The voice came from the door. A man Claire didn't know, civilian clothes, credentials already in his hand, with 2 people behind him in suits and a uniformed military attorney behind them. "I'm Special Investigator Marsh, Deputy Inspector General's office," he said. "We have a matter to discuss with you. I need you to come with us." Lennox looked at Marsh, then she looked at Claire. Claire held her gaze. She didn't look away, and she didn't look triumphant. and she didn't offer anything for Lennox to read that would confirm suspicion or satisfy curiosity. She just looked at her, steady, present, clear-eyed, the way she'd looked at monitors in trauma bays when the numbers were telling a story she needed to understand without flinching from. "I see," Lennox said. Her voice was entirely flat. She stood. She didn't look at Claire again. She walked to the door with the self-possession of someone who knows that how you move in the worst moments of your professional life becomes part of the record, and she walked through it with Marsh and his team, and the door closed behind her, and the conference room was very quiet. What followed was not cinematic. That was the thing nobody told you about institutional accountability. The drama happened in short, concentrated bursts, and then everything became process, which was slow and specific and unspectacular and necessary. Claire spent the next 3 hours in a small office down the hall, giving a formal statement to a member of Marsh's team. She described the sequence of events from the phone call from Bale through the walkthrough, answered specific questions about the archive visit, documented her characterization of Lennox's response to the retrospective review question. The investigator was thorough and did not lead her and took everything down with the care of someone who knows this material will be read by people looking for inconsistencies. She was not in the room when they found the backup directory. Bale told her about it afterward. They'd accessed it with the cooperation of the Fort Calhoun system administrator, a specialist too who had been nervous and cooperative in equal measure and who had produced the backup directory path from memory within 10 minutes of being asked. The original clearance document was there, complete. The notation regarding the pre-existing cardiac condition that should have grounded the participant, present, and time-stamped and uncorrupted. They pulled the Georgia copy from Fontaine's transferred file. They placed the two documents side by side in the evidentiary record. The comparison required no annotation. The gap between them was visible to anyone who looked. Fontaine was contacted by the CID team in Georgia at 2 in the afternoon Nebraska time. Claire didn't know what he said. She would find out later through Bale that he had asked for a JAG attorney within 30 seconds of being approached and had then, after 40 minutes with that attorney, begun cooperating. He confirmed that Lennox had contacted him after the exercise and instructed him to modify the transferred record. He had done it because she was his superior officer and because he had been afraid of the consequences of refusing. He had also, it emerged, sent the email to Claire from the Fort Calhoun terminal, not on Lennox's instruction, not on Bale's instruction, but on his own initiative, out of something that was a mix of guilt and self-protection and the particular desperation of someone who has done something wrong and is looking for a way out that doesn't require saying it directly. That was the variable Bale hadn't accounted for. A frightened man with enough conscience to leave a breadcrumb but not enough courage to sign his name to it. Human beings were not simple. That remained true even inside institutional corruption. At 4:15, Stahl appeared in the doorway of the small office where Claire was finishing her statement. He looked like someone who had had a difficult afternoon. His jaw was set in a way it hadn't been yesterday, and he'd clearly been in several rooms with several people he'd had to process information from in rapid succession, because there was a particular kind of cognitive fatigue that comes not from physical exhaustion, but from having your picture of a situation revised multiple times in a short window, and it was visible in him now. "You knew this morning," he said. It wasn't an accusation. It was a statement of fact, delivered with the evenness of someone working to be fair. "I knew enough," Claire said. "I didn't know all of it." "Bale." "Yes." He was quiet for a moment. He came into the office and sat down in the chair across from her, not because he was interviewing her, that was done, but because he apparently needed to sit. "I put you across a table from her this morning," he said. "I set up that orientation. I thought I was helping you." "You didn't know." "I should have." He stopped. "I vouched for this program to you. I told you Lennox had driven up from Kearney because she cared about the investigation." "She did drive up from Kearney," Claire said, "and she did care, just not in the direction you thought." He looked at her with an expression that had several things in it: frustration and the specific discomfort of someone who has been used as a vector without their knowledge. And underneath those things, something that was more honest than either. "I'm sorry," he said, "for whatever my part in this cost you." "Your part in it brought Kowalski through my ER," she said. "I'm not running the ledger on that." He didn't say anything for a moment, then, He's asking about you. Again. He needs to rest. He knows that. He's asking anyway. The corner of Stahl's mouth moved slightly. He says he'd like to thank you properly when he's not attached to a drainage tube. Tell him there's time, Claire said. Lennox was placed on administrative suspension pending formal investigation at 5:40 that afternoon. The order came from Washington. She was escorted from the installation by the military attorney who had accompanied Marsh's team, with her credentials suspended and her access to all Army systems revoked pending review. She walked out of the administration building into the flat Nebraska late afternoon in full uniform, surrounded by people, with her face arranged into something that was not quite neutral and not quite composed and was, Claire thought when Bale described it later, the most human she'd probably looked in years. It was not satisfying in the way satisfaction is supposed to feel. It was the feeling of a door closing, necessary, appropriate, a correct outcome, but not triumphant. The cost had already been paid by other people. Kowalski, in a trauma bay with a pressure of 44/26, the participant in the exercise who'd been cleared improperly. Fontaine, who had signed a document he'd been pressured to sign and then spent 3 weeks in Georgia carrying the weight of it. Lennox's suspension was not an erasure of those costs. It was just the mechanism by which they stopped accumulating. The drive back from Fort Calhoun to Fort Calhoun, she'd realized on the way out that she'd been thinking of the drive as going home, meaning back to the apartment, meaning back to the small life she'd built in the 14 months before all of this, took 40 minutes, and she used it the way she'd used her run that morning, without management. She let her mind do what it needed. She thought about the legal pad on her kitchen table, the protocol's gap she'd mapped from memory in 40 minutes, the specific procedural flaw, the expedited clearance pathway, the system that created efficiency at the expense of redundancy, that had not been caused by Lennox's corruption but had been exploited by it. The corruption would be addressed now. The flaw would not be, not automatically, not unless someone built the fix and put it in front of the people who administered the system. That was the actual work. Not the investigation. The investigation was done. The actual work was the piece that remained when the crisis was over and the accountable parties had been removed and the institutional machinery had gone back to grinding at its normal speed. The curriculum development program was real. The JSOMTC initiative was real. The resources and the mandate and the pipeline to training standards, all of it real, and now available without Lennox's fingerprints on it. She pulled into her parking spot and sat in the car. Her phone had 3 missed calls. Kolf, twice, and a number she recognized from Fort Calhoun's medical clinic, Kowalski's ward. She called the clinic back first. A nurse answered. "This is Whitmore," Claire said. "I had a missed call from this number." One moment, rustling. Then a voice that was thinner than it had been in the trauma bay but recognizable. The particular flatness of someone managing pain medication with the willful coherence of a person who has decided the conversation is important enough to have now. "Major," Kowalski said, "you should be asleep." "Yeah." He sounded like he thought that was funny but didn't have the energy to express it. "I heard things went sideways today." "They went forward," she said. "That's different from sideways." A pause. She could hear him breathing, slightly careful, the rhythm of someone with chest drainage who has learned to take stock of each breath before committing to it. "I didn't know," he said. "About Lennox. What she was doing." "I know that. Stahl told me. He said you knew and you went in anyway. The work needed to be done. That's..." He stopped. Started differently. "That's the most you think I've heard yet, and I've known you for about 48 hours. Another pause. "The protocols. The clearance gap. Is someone going to fix it?" "Yes," she said. And then, because it was the honest answer, "Me, probably." "Okay," he said. Like that settled it. Like that was the expected answer and he'd been waiting to hear it confirmed. "Good. Kowalski, go to sleep." "Yes, ma'am," he said. She called Kolf at 7. "I heard from Colonel Lennox's office," Kolf said. "Through official channels, about the suspension." She paused. "Are you all right?" "Yes." "I also heard, and I want to be precise about this, that your protocols analysis this morning was what gave the investigation team the evidentiary framework they needed to understand the record's falsification. That you identified the gap. A pause. From memory. I worked on the original protocols, Claire said. I know where the weaknesses are. That's exactly the point, Kolf said. Her voice had shifted. Not warmer exactly, but more direct. The way voices get when someone has decided to say the thing they've been building toward. I have a proposal for you, and I want you to hear it before you make any decisions about the Army reinstatement, whatever form that now takes. I'm listening? I'd like to offer you the position of Trauma Services Director at Crestwood. It's a new role. I'm creating it specifically, which means you'd build it from the ground up. Oversight of trauma nursing, protocol development, training standards for the emergency department, full clinical authority in your scope. A pause. The Army program is 40 minutes away. If the reinstated version of that offer is 3 days a week at Fort Calhoun, the two things are not mutually exclusive. Claire stood in her kitchen with the phone and the cooling coffee and the legal pad on the table and the river visible in the last of the evening light, and she thought about Priya Sundaram saying the kind of teaching that actually sticks. She thought about the 4 pages of notes on the protocols gap. She thought about what it meant to use what you were built for, not in the sense of returning to something, but in the sense of finally stopping the effort of being something smaller. I'll need the authority to be real, Claire said, not nominal. If I'm setting training standards, no one overrides them for scheduling convenience. Agreed. And I want Priya Sundaram on the trauma roster. A brief pause. Done. Then yes, Claire said. 3 weeks later, Fort Calhoun's training cadre received a revised protocols document for the pre-deployment medical clearance process. The expedited pathway had been closed. A mandatory dual verification requirement now applied to all participants, regardless of historical record. The modification had been drafted by Major Claire Whitmore, Army Nurse Corps, reinstated, in consultation with the JSO-MTC curriculum team. It had been reviewed by the Army Surgeon General's office. It had been implemented across Joint Special Operations training elements within 14 days of submission, which was fast for institutional machinery, and which several people who worked inside that machinery noted was unusually fast, and which Stahl privately attributed to the fact that when someone with Claire's record submits something, and it is immediately verifiable by documentary evidence, and supported by the accounts of the soldiers who had been on the ground when the old system failed, the institutional resistance to action tends to be lower than average. Lennox faced a formal court-martial inquiry. The charges included falsification of military records, obstruction of an official investigation, and abuse of authority. The inquiry was ongoing. Fontaine, in exchange for full cooperation, received administrative separation rather than criminal prosecution, which was a negotiated outcome that was not fully satisfying to anyone and was the kind of resolution that actual institutional accountability tends to produce. Partial, imperfect, consequential enough to matter. Elaine Voss's termination from Crestwood was finalized. The nursing board review of the misconduct complaint was closed with a finding of substantiated systematic harassment. Her license was not revoked. The board found the clinical record insufficient to support that outcome. But the finding was on record. She appealed through her union. The appeal was pending. Garrett had requested a meeting with Claire in the second week after the incident. He had come to her office. She had an office now, small, with a window that looked out over the parking structure, not the river, but it was hers. And he had sat in the chair across from her desk and said, without preamble, "I'd like you to supervise my trauma procedure training going forward, if you're willing." She'd looked at him for a long moment. He'd held the look. He was not a bad doctor. He'd never been a bad doctor. He was a doctor who had learned something about himself in a trauma bay on a Tuesday night, which was not the worst thing that could happen to a person. "Tuesdays," she said, 8 to 10. We start with chest decompression." He'd nodded. "Thank you," he said. "Don't thank me yet," she said. "I'm harder on people I think can actually improve." He'd left without knowing entirely how to take that, which she felt was probably appropriate. Kowalski was discharged from the Fort Calhoun Clinic on a Thursday morning in late October, with instructions that he followed to approximately 40% of their intended degree, which was better than average for a ranger. He drove to Crestwood that afternoon. Stahl had told him not to, for reasons of prudence that Kowalski had acknowledged and set aside. And he walked into the emergency department and asked for Claire Whitmore. The nurse at the front desk told him she was in a training session. He said he'd wait. He waited for 45 minutes in a plastic chair near the triage desk, looking approximately as comfortable as a man with 2 weeks of healing chest trauma has any right to look, and he did not complain. When Claire came out, she stopped at the end of the corridor when she saw him and then walked toward him with the particular unhurried pace that she moved at when she was assessing, and the assessment hadn't yet produced alarm. He stood up. He was not in uniform. He looked like a person, which was slightly different from how he'd looked in the trauma bay, where he'd looked like a casualty. "You drove yourself here," she said. "My left arm did most of the work." "That is not reassuring." She looked at him. At the way he was carrying his posture, the slight protective lean to the right that told her the chest wall was still complaining. "You're compensating on the right side." "It's manageable." "I didn't ask if it was manageable. I noted that you're doing it." She gestured toward the chairs. "Sit down before you fall down." He sat. She sat across from him. Neither of them said anything for a moment. "I wanted to say thank you," he said, "properly, not through a phone relay." "You already said it," she told him, "in the trauma bay, with the salute." "That was a different kind of thank you." He looked at her directly. "That was for the first time you saved my life. In 21. I was on one of the teams you treated during the deployment. I didn't know it was you until I saw you in the ER, and then I was pretty far gone. But I knew." He paused. "You spent 4 hours keeping a guy alive until the surgical team could get to him. I heard about it after. Everyone in the unit did." "I remember the case," Claire said. "I didn't know you were there." "I was 2 tenths over." He looked at his hands. "The man you spent 4 hours on is a team sergeant now. He got married last spring. He's got a kid." The hallway around them had the ordinary sounds of a working hospital: movement, voices, a monitor tone somewhere down the corridor. Claire looked at Kowalski's face. The gray eyes, less glassy than they'd been in the trauma bay, clearer now, with the specific quality she'd noticed even then: focused, direct. The face of someone who has decided the conversation matters and is giving it their full attention. "The protocols document you wrote," he said. "Stahl told me. The dual verification requirement." Yes. That goes into effect this month. It's already in effect." He was quiet for a moment. "How many guys does that cover?" She thought about the training cohorts, the annual volume, the specific statistical distribution of pre-existing conditions that the expedited pathway had been designed to skip. In a year, across joint elements, maybe 300 who go through the full screen who might otherwise have gone through the expedited path. A pause. "Most of them would have been fine regardless. Some of them wouldn't." "Some of them," he said. "Yes." He nodded. He didn't perform emotion about it. He just nodded, and the nod contained an acknowledgement of the weight of that number that was more honest than any expression would have been. "Thank you," he said again, differently this time, not for the trauma bay, for the document, for the 4 pages of notes written from memory on a legal pad in a kitchen in Fort Calhoun, Nebraska, by a woman who had tried very hard for 14 months to be only part of what she was, and had eventually given up trying. She looked at him. She thought about what it cost to carry the skills you carry without being permitted to use them. The way it sits wrong, like a weight distributed incorrectly, not heavy enough to break you, just persistent enough to wear. She thought about all the ways people get diminished, not by catastrophe usually, by accumulation, by small corrections and reassigned carts and name tags left off memos and orders delivered with the implied assumption that the recipient will comply because they don't matter enough to push back. She thought about Priya, who had been asking the right questions and getting less than she deserved in return. She thought about the team sergeant who was married now, with a kid, who had survived 4 hours in a tent because someone had chosen not to step away when there was still something to be done. She thought about herself, the version of herself who had driven to Crestwood 14 months ago and told herself that a smaller life was a sustainable life, and had been wrong, and had needed to be wrong, and had eventually been given an unmistakable proof of the fact. Not everyone gets the proof. Some people spend entire careers being smaller than they are, and the proof never arrives, and they carry that, and it leaves marks. Claire knew she'd been lucky in the way that luck sometimes disguises itself as hardship. The hard thing had happened in a way that had a resolution. She was not going to waste the resolution. Go home, she told Kowalski. Sleep. When you're cleared for light duty, Stahl can tell you where to find me. He already knows, Kowalski said. He stood, with the careful economy of a man whose chest wall had opinions about rapid movement. We all do. She walked him to the exit. She stood at the door and watched him cross the parking lot toward his vehicle with the measured pace of someone respecting their own recovery. And she thought, that's the work. Not the drama of the trauma bay. That had been one night, one patient, one procedure. The work was the document on the server at the Surgeon General's office. The training session with Garrett on Tuesday mornings. Priya learning on a floor that now had different standards. Kowalski being able to walk out of a parking lot because a man in Georgia had spent 3 weeks not sleeping well and had eventually sent a 4-word text message, and the thread of accountability that had pulled on had not stopped pulling until it reached the thing it needed to reach. None of it was clean. None of it was smooth. The bureaucratic record would show suspensions and terminations and an ongoing court-martial inquiry and an appeal pending in a union process, all of it grinding along in real time, imperfect and incomplete and continuing. That was how institutional justice actually worked, not as an arrival, but as a direction. You pointed it at something true, and you pushed, and the grinding was the sound of it moving, and you had to be willing to tolerate the grinding for the movement to happen. She turned and walked back into the hospital. She had a protocol review to finish and a training session to prepare, and a conversation with Priya about the new trauma roster schedule that she'd been looking forward to in the specific low-key way she looked forward to things now. Not with the distant hope of someone waiting for a life to begin, but with the immediate practical anticipation of a person who has work she's actually built for, in a place she has decided to be, doing what she knows how to do at the fullest extent of what she knows. The difference between those two states was not small. It had taken her 14 months to understand that, and one Tuesday night to prove it. She was not going to forget either part. Kowalski was discharged from the Fort Calhoun Clinic on a Thursday morning in late October, with instructions that he followed to approximately 40% of their intended degree, which was better than average for a ranger. He drove to Crestwood that afternoon. Stahl had told him not to, for reasons of prudence that Kowalski had acknowledged and set aside, and he walked into the emergency department and asked for Claire Whitmore. The nurse at the front desk told him she was in a training session. He said he'd wait. He waited for 45 minutes in a plastic chair near the triage desk, looking approximately as comfortable as a man with 2 weeks of healing chest trauma has any right to look, and he did not complain. When Claire came out, she stopped at the end of the corridor when she saw him, and then walked toward him with the particular unhurried pace that she moved at when she was assessing, and the assessment hadn't yet produced alarm. He stood up. He was not in uniform. He looked like a person, which was slightly different from how he'd looked in the trauma bay, where he'd looked like a casualty. "You drove yourself here," she said. "My left arm did most of the work." "That is not reassuring." She looked at him, at the way he was carrying his posture, the slight protective lean to the right that told her the chest wall was still complaining. "You're compensating on the right side." "It's manageable." "I didn't ask if it was manageable. I noted that you're doing it." She gestured toward the chairs. "Sit down before you fall down." He sat. She sat across from him. Neither of them said anything for a moment. "I wanted to say thank you," he said. "Properly. Not through a phone relay." "You already said it," she told him. "In the trauma bay. With the salute." "That was a different kind of thank you." He looked at her directly. "That was for the first time you saved my life. In 21. I was on one of the teams you treated during the deployment. I didn't know it was you until I saw you in the ER, and then I was pretty far gone, but I knew." He paused. "You spent 4 hours keeping a guy alive until the surgical team could get to him. I heard about it after. Everyone in the unit did." "I remember the case," Claire said. "I didn't know you were there." "I was 2 tenths over." He looked at his hands. "The man you spent 4 hours on is a team sergeant now. He got married last spring. He's got a kid." The hallway around them had the ordinary sounds of a working hospital. Movement, voices, a monitor tone somewhere down the corridor. Claire looked at Kowalski's face. The gray eyes, less glassy than they'd been in the trauma bay, clearer now, with the specific qualities she'd noticed even then. Focused, direct, the face of someone who has decided the conversation matters and is giving it their full attention. "The protocol's document you wrote," he said. "Stahl told me. The dual verification requirement. Yes, that goes into effect this month. It's already in effect. He was quiet for a moment. How many guys does that cover? She thought about the training cohorts, the annual volume, the specific statistical distribution of pre-existing conditions that the expedited pathway had been designed to skip. In a year, across joint elements, maybe 300 who go through the full screen who might otherwise have gone through the expedited path. A pause. Most of them would have been fine regardless. Some of them wouldn't. Some of them, he said. Yes. He nodded. He didn't perform emotion about it. He just nodded, and the nod contained an acknowledgement of the weight of that number that was more honest than any expression would have been. Thank you, he said again. Differently this time. Not for the trauma bay. For the document. For the 4 pages of notes written from memory on a legal pad in a kitchen in Fort Calhoun, Nebraska, by a woman who had tried very hard for 14 months to be only part of what she was, and had eventually given up trying. She looked at him. She thought about what it cost to carry the skills you carry without being permitted to use them. The way it sits wrong, like a weight distributed incorrectly. Not heavy enough to break you, just persistent enough to wear. She thought about all the ways people get diminished, not by catastrophe usually, by accumulation, by small corrections and reassigned carts and name tags left off memos and orders delivered with the implied assumption that the recipient will comply because they don't matter enough to push back. She thought about Priya, who had been asking the right questions and getting less than she deserved in return. She thought about the team sergeant who was married now, with a kid, who had survived 4 hours in a tent because someone had chosen not to step away when there was still something to be done. She thought about herself, the version of herself who had driven to Crestwood 14 months ago and told herself that a smaller life was a sustainable life, and had been wrong, and had needed to be wrong, and had eventually been given an unmistakable proof of the fact. Not everyone gets the proof. Some people spend entire careers being smaller than they are, and the proof never arrives, and they carry that, and it leaves marks. Claire knew she'd been lucky in the way that luck sometimes disguises itself as hardship. The hard thing had happened in a way that had a resolution. She was not going to waste the resolution. Go home, she told Kowalski. Sleep. When you're cleared for light duty, Stahl can tell you where to find me. He already knows, Kowalski said. He stood, with the careful economy of a man whose chest wall had opinions about rapid movement. We all do. She walked him to the exit. She stood at the door and watched him cross the parking lot toward his vehicle with the measured pace of someone respecting their own recovery, and she thought, that's the work. Not the drama of the trauma bay. That had been one night, one patient, one procedure. The work was the document on the server at the Surgeon General's office. The training session with Garrett on Tuesday mornings. Priya learning on a floor that now had different standards. Kowalski being able to walk out of a parking lot because a man in Georgia had spent 3 weeks not sleeping well and had eventually sent a 4-word text message, and the thread of accountability that had pulled on had not stopped pulling until it reached the thing it needed to reach. None of it was clean. None of it was smooth. The bureaucratic record would show suspensions and terminations and an ongoing court-martial inquiry and an appeal pending in a union process, all of it grinding along in real time, imperfect and incomplete and continuing. That was how institutional justice actually worked, not as an arrival, but as a direction. You pointed it at something true and you pushed, and the grinding was the sound of it moving, and you had to be willing to tolerate the grinding for the movement to happen. She turned and walked back into the hospital. She had a protocol review to finish and a training session to prepare, and a conversation with Priya about the new trauma roster schedule that she'd been looking forward to in the specific low-key way she looked forward to things now. Not with the distant hope of someone waiting for a life to begin, but with the immediate practical anticipation of a person who has work she's actually built for, in a place she has decided to be, doing what she knows how to do at the fullest extent of what she knows. The difference between those two states was not small. It had taken her 14 months to understand that, and one Tuesday night to prove it. She was not going to forget either part.